You need to make full page.
That's okay.
Yes, yes. Now you are in full page. Yeah.
Okay.
You can go ahead.
Sorry for this technical problem. There was two similar pages, so it was because of that. First of all, I want to tell everybody that I want to have a very interactive presentation. I don't want to be talking from a PowerPoint slide and be talking myself. You can cut my presentation whenever you want. You can ask whichever questions you like, whenever, at which point of the presentation you want. I will not be disturbed about this. Personally, I'm a dentist, as dear President introduced. I am a dentist since 22 years. I'm still working with my patients, and while I'm making this presentation to you, my few patients are in the waiting room, and it's very good for me because I'm still in the field and in the stage as a dentist. But such kind of knowledge and such kind of dental environment to explain in such a short time is maybe not so possible. But the name of my presentation is DENTAPOL treatments, as you see, because I will try to explain all kinds of treatments in dental area to everybody today. But as I told you, it's not so possible. But I will do my best to introduce the most common treatments that we use in Turkey, because my country, I'm proud of this, is very good on dental treatments, really. And we are really one step ahead of many countries, and really from the side of hygiene, from the side of aesthetic, really we are really good as a country, we are really good on dentistry. Let's start. The first step of dental treatment is anesthesia, and anesthesia is really very important. And to make the patient comfortable, you have to apply a very successful anesthesia. We are using very good techniques and technologies to make this anesthesia. In this video, you'll be seeing how it works. This is a video presentation. You see the gum tissues, and on the gum tissues, there are nerves. If there's a pain or some problem in front of your teeth, you see it gives alert to your brain, and it says, I have a problem. And to be able to work on that area, you have to apply a good anesthesia. And after this good anesthesia, you'll be able to making the patient's treatment with no pain. And you know, everybody is afraid of dentists, but there is no need to be afraid of us, because if we apply a good anesthesia, the patient will feel nothing. And because of the techniques that we use during making the anesthesia, the anesthesia itself is also not something like painful. It gives very small pain, like an insect touch to your body. So after making the anesthesia, we'll start the treatments of the patients. And the treatments of the patients is very important, but sometimes some patients comes to us with not as a problem, with not as a patient. They are coming to us only for aesthetic reasons. They normally have no problems, they have no pain, they have nothing to suffer, but they only need more aesthetic teeth and more whiter teeth. So during this procedure, first of all, we always advise the patient start with teeth cleaning and teeth whitening. Today, I will not show you teeth cleaning because everybody knows what teeth cleaning is, but I'll be talking about teeth whitening. And there is something else which everybody says and talks about. Is teeth whitening harmful, or can teeth whitening give harm to my teeth? Is it something giving some bad results after whitening, or there will be any problems? People say many wrong things, and the truth is that if you are using a good whitening system and if you are making this treatment in a good clinic with a good dentist, you will not have any problem, because you'll see now this is the color of the teeth. First of all, we start the patient's treatment with protecting the gum tissues, because our procedure is teeth whitening, not gum whitening. Because if the solution that we use to whiten your teeth touches your gum tissues, it may be really harmful. But with a good protection on the gum tissues, you will not have any problem. The second step, as you see, is to apply the material which will whiten your teeth, and it's not harmful for the surface of your molars, premolars, or anterior teeth. After that, as you see, we give light. There is a light which we apply, and then we clean. As you see, after cleaning, of course, this is a video, but after cleaning, all my patients say, "Oh, doctor, it's really unbelievable," because the result is really unbelievable, because it works really good. And at the end of the session, after maybe 1 hour, it's a short session, which is 1 hour, these patients are really very successful, very satisfied after the procedure. And it is not harmful, it's not painful, I swear. We also make some fillings. You see on this teeth, there's a filling, but you don't see any difference between the other teeth. The caries starts, and then you clean the caries. It's also not painful because we make anesthesia to make this, and then we place a metal brace around the teeth, and so as the material is not going anywhere else that we want, we make a border, and in this border we are applying the material. And then the second step, and then the third one, and the color, and then we give light to harden the material, and we go on step by step. We have to be very careful during these applications, because dentistry is something that you have to be very careful in every step. Then we polish the surface, and after polishing, you see there's no difference between the neighbor teeth and the other. The result is perfect, and in this way you'll be able to prevent the teeth, and you will not make any crowns. You don't extract the teeth. You don't need any root treatments. If you go to your dentist as early as you can, you may have the best result as seen on the table, and you will be very satisfied. Less pain, less payment, less time, everything will be less. But if you wait, everything will be growing day by day. And there's another application. Sometimes some of our teeth are moving because of some gum problems. If the patient has gum problems, the patient will be very suffering from while biting something, chewing something, eating something. There's a application with fibers, and this is very good for the patient. You see, these are the teeth of the patients. It's moving because of gum problems. But the neighbor teeth are more strong and more stable, and we apply acid etching on the surface, and then we wash. We place composites, 20 minutes waiting time. And then we go ahead to the second step with the materials. We place the fiber. This is a fiber material. It's very strong and it's very biocompatible. And 20 seconds more. And good neighbors protect the poor neighbor, you see. And I always explain my patients like this. There's a poor neighbor and the others are stronger, so they help the poor one. And in this way, the poor and the moving one will be more durable and more stable in the mouth and will be serving the patient long time. And we have some white spot lesions in the mouth, and we need to clean them. It's very, very easy, but if we leave them in that way, they may be harmful. So we work in a very, very easy way with the white spot lesions, and in this way we'll be serving the patient really very, very good result. Sorry. You see the white spot lesions on the teeth. The surface is not in the same color. As I mentioned, the white spots, they are lesions, and if you don't treat them, they grow day by day. And then we use a special material and special polishing machine to clean these areas, and then give laser light. And finally, the teeth is the same color in any area of the crown. Root canal treatment. This is one of the treatments that patients are always afraid of, and they think that it is very, very difficult procedure and very painful procedure. As I mentioned at the beginning, the first step is to make a good anesthesia, and then you can make everything on teeth, even root canal treatment. And you start your root canal treatment with anesthesia. And since we are using very good machines, not with our hands, we are making these treatments with machines, very, very special machines. And these machines help us to be able to make treatment in the best way, to stop in the correct point, and to be able to clean the caries and the unwanted materials and the materials that are giving pain to the patient very, very easily. You see, this is a teeth. Most dentists say that you have to extract this teeth. The teeth is really in not good position, and it's really very, very bad. But it's possible to repair this teeth, even this teeth, even the ones that are worse than this one. We first of all clean the area with a big one, then go ahead until we reach to the roots. Then we clean the roots. The roots are cleaned. You see the apex of the molar is not good. We do the cleaning several times, several times. Wash and clean, but no pain, no problem. Then we place the sponge in the crown, and then we place. We wait. Sometimes we do this. This is the way that we do sometimes. Normally, we finish the treatment in the same day. We wait for a while and then clean again. Because these teeth has lesions. You see in the apex of the teeth. These are big, big lesions. So we have to make several times of cleaning in such teeth. Then place again, and the temporary filling, wait for a while again. You see the healing in the roots. Roots are healed now, and then we wash, we dry, we place we call them gutta perca. There are some kinds of plastic material. We fill in the roots with plastic material. You see the apex is very, very healthy now. The bone is very healthy. The crown is very, very healthy. Then we place the filling. We apply light. And finally, the teeth is again very, very healthy. And it will serve the patient for many years. In such kind of operation, the patient don't need any extraction, don't need any implants or something. Yes, implants. There's something that many patients think, again, it's very difficult job and it's very painful thing, but trust me, it's really very easy surgery. You see there's a teeth here. The patient lost, unfortunately, the teeth. The gum tissues are healing. We cut and first open see the bone, place the implant, place some material and membrane, biomaterial, and then close. Then close the flaps. Wait for a while. And it's done. This video will show you the placement of the implant in the posterior region. You see there's a space here. The teeth is not there. There is a lost teeth, missing teeth. We place the implant. It is like a screw. You see, there are screws on the implant, and it's going ahead through the bone, like a screw going in the wall or in the wood. It's going ahead. And in this way, we place the implant, and that's all. Anterior region is more important while placing the implant, because the aesthetic area has to be more a place that we have to be very, very careful, because if you place the implant in the wrong angulation, you may have very, very big aesthetic problems with the patient. You see here, there's an anterior teeth. We make a drilling in the bone. And after drilling, we place the implant just in the same angulation with the neighbor teeth, neighbor anterior teeth. We check the angulation, we correct. Yes, it's perfect now. You see, it's like in the same direction with the root of the teeth. The direction should be in the same angulation, because if the angulation is incorrect, you will not be able to place the implant in the correct angle, and the patient will not be satisfied with the implant, with the crown that you managed. And there is another way to make the implant. We call it minimal-invasive method, because this method is really very, very important, because we always want to work with the patient in minimal invasive way. In this way, we don't make the missing teeth, you see. We don't make any drilling and anything. We just directly place the implant in the bone, because we want to be more minimal invasive. And then we place the abutment and then the crown. We place some glue in the crown, and then we place it there. all-on-4 implant system. All-on-4 implant system is really very important and very popular nowadays. The founder of this system is very good friend of mine. He's Molar. He's a very important man in our field, and our people respect him very much. And this method is very useful method, because by this method you may be able to place implants to the patients with a very big bone loss, and you will be able to make immediate loading. Immediate loading is very important procedure, because with this immediate loading, you'll show the patient prosthesis as soon as you place the implants. Let's see the video. You see there's a patient with no teeth and really big bone loss. The hole you see is the place that the nerves are coming out, and because that area is very important for us. You see, with angulation, you place the posterior implants, and the anterior implants are in the direct angle, but the other ones are about 37 degrees angulated. Then you place the multi-unit implant abutments. After closing the gum tissues, you place the prosthesis, and you don't use any glue, you see. You just screw them, because these are screw retained in prosthesis, and the prosthesis will be retaining there with screws. No glue, nothing to place inside. This is another method with, again, 4 implants, but this time we have enough bone, so we place the implants in direct way and direct angulation. We call it dolder bars. We place the bars between the implants, and we place the dolder bars, female parts, in the prosthesis, and then we place the prosthesis. And in this way, there is even no screws, but the difference is that this prosthesis is removable one. The prosthesis can be taken out and placed again. The patient can replace the prosthesis from the mouth and then place it in the mouth again. But in all-on-4, the previous one, the patient should go to the dentist for the checks and to take the prosthesis out, because it's screw retained, and only a dentist can take the prosthesis out. And this is the way of bridge metal plated side tooth. You see here there's the teeth. Sorry. This teeth is missing. The patient don't want any implant. We unfortunately cut the neighbor teeth, make some preparations on the crowns, and they become smaller. And then we make the bridge, but it's not something that we want. We prefer less harm and be more invasive to the teeth, because we respect your tissues very much, and the best way for this respect is placing implants. And after making these bridges, the clinic procedure is also very important. You see there's a bridge here. To clean the surfaces between and under the crowns, between the gum tissues, you need to use very special floss. Because if you don't use such kinds of floss, there will be bacteria around the crowns. You see, you clean in between the crowns. That's all. Periodontosis is also a very important thing for us. You see, after periodontosis, you'll have bone loss and tissue loss in the gum and in your hard tissues. Both soft and hard tissues are really in bad position by periodontosis. You have to clean around the roots and the crowns because there is bleeding there. You have to finish first of all bleeding and then place some biomaterial to correct the problem there. And then healing starts again and then it's done. Now it's successful and it's healthy again. Osteoplastic upper jaw is something I want to show you as well. I hope it's not boring. It's my job and it's very enjoyable for me. I'm trying to not bore anybody, but I'm sorry if I bore you with these videos. But I'm using not real videos, and I don't want to show you any blood or any real tissue. I want to show you the as sweet as I can. You see, there is bone loss. We place the bone. Additional bone because there is bone loss. We screw the bone there. We close with membranes. Wait for a while. We place membrane, close the soft tissues. Then we are able to place a successful implant in the area because now we have enough bone. For us, bone is no problem. In no case, we say the patient, sorry, you have less bone, so we can't place you implants. We can place any kind of bone, but we need some more time if we have less bone. Orthodontic treatments are also important, but for patients, braces are really something that they don't want. So while using these braces, the patient don't want to see them and they don't want to any metal thing in the mouth. So we are using aligners for these kinds of treatments now. You see, this patient has problems. You see, you perform the aligners. They are invisible. That's why we call them Invisalign. They are clear aligners. We place them in the mouth, and there is no difference. And the patient can sometimes take them out and replace again himself. Molar distillation. In some cases, we need to move the molars a little bit more distal area because there is not enough space in the anterior region. We need to move the crowns a little bit backwards. You see, we perform orthodontic apparat, and with this apparat, we enlarge the mouth and we carry the molars more distal and then push the anterior teeth backwards, and it's done. Now it's perfect. And for these kinds of treatments, in earlier years, we were saying our patients that sorry, you can have this treatment only until 16 years old age. But now, even our patients is 70 years old can have these treatments. There is no age limit for orthodontic treatments. Bracket cleaning. To clean the braces is very important because around the braces, sometimes the patient have really big problems and very big food infections.
Dr. Genc, we are over the time.
I just checked my watch, and deep close is also very important. I am going forward.
Please take your time and try to finish early as possible.
Thanks a lot. Deep closure was not so important, so I place it at the end of the presentation. Thanks everybody for your attention. Hopefully we'll be meeting again anywhere in the world or any online presentation. All the best and best regards.
I think if you can stop your sharing, Dr. Genc, we have one question quickly that we can able to get from you. One of the listeners saying that how much time we need to stay in Turkey for implant implementation, I mean implant treatment.
You need to come twice. First treatment is 1 or 2 days. After first step of surgery, in 1 or 2 days. After 3 to 6 months, we are waiting you in Turkey again. And in the second visit, we need about 10 days to finalize everything.
So there is no method that you done everything in once. No need to have second visit.
We do have, but we need a good bone. We have to check the bone first. If we have enough bone, I don't want to promise, but if the patient has enough bone and if everything is okay with the patient age, systemic diseases, if everything is okay, we can finish everything 1 day, even in 1 day, because we call it a teeth in a day, and teeth in a day procedure is very good, but we cannot apply it in any cases, in all cases.
I think we have one more session with you in 1 o'clock.
Yeah.
That's why there is several other questions, but we ask you in next presentation.
My other presentation is shorter than this one. Sorry, because this was dental.
We will have more time to ask the question.
Yeah, I'll make that presentation shorter, and we'll be able to talking anything. And in the second presentation of mine, I'll be showing. This time I did not have enough time. In the second presentation, I will show you some before and after cases.
That's great.
And I will have a big surprise for everybody who are listening to the second one. We'll have a gift for everybody and all patients.
Thank you. Thank you very much, Dr. Genc, for a lovely presentation. It was first time for me as well to see in such details showing that all treatment plans. That was very educative part for me as well. And I'm seeing that from platform, a lot of doctors making comment that it was very useful presentation for them as well with the new technique of treatment. We'll see you shortly after 1 hour. We will be
President, for giving this chance to me, dear President. Really big thank to you and all THS team for this chance of talking and meeting my colleague.
Thank you very much, Dr. Genc. We'll see you later on again with your presentation.